Hello everyone, in this video we'll be talking on a white patch on an eyelid. Well, you must have seen a lot of people specifically on this side, and sometimes even on a lower eyelid, on the upper eyelid, the medial side, okay, and on the lower eyelid. You may see the people with the white or the yellowish color patch. So what is it? It is something like a vitiligo, or what is it? So basically, in a medical terminology, it is called as a xanthelasma. Yes. So what is xanthelasma? It's pretty simple. When you have a deposition of a cholesterol fat, cholesterol flax, you have a deposition just beneath the eyelid, is called as a xanthelasma. Why it happened? There are many reasons. I will not going to go into the detail of it. But is it harmful to the body? No. There is any functional problem? No. Then why people remove it? It is only for the cosmetic concern, because it is very much obviously visible. So no one would like to have such kind of a patch on their face. So people go for the removal. So what are the different methods to remove it? Well, previously, I'm talking a long back, people used to use some salicylic acid, that is to burn, that is a chemical burning. Right now also there are a lot of chemical peels can be done. Something called as a PCA cross peel also can be done. Then there is a radio frequencies. It is like an ablative kind of, you use the electrical energy and ablation of the tissue. And something which is the most cosmetic is a surgical removal. What happened? Those flax, the deposition, it is not in a specific shape. It can be a round, oval, or most of the time it is in an irregular shape. So once you burn, whatever new skin you get it is generally less amount of a melanin pigment is there, so it looks little white in color, and sometimes it looks there is a PIH, post-inflammatory hyperpigmentation, so it looks black in color. So the most cosmetic is blepharoplasty, like how you do the upper eyelid surgery. Similarly, you remove the complete chunk, you remove all whatever the cholesterol flax is deposited there, and then you stitch it back. Okay, we use the suture which is even thinner than the hair, so it gives you a very good appearance. The suture line is barely visible after the surgery. Once you give at least 18 to 20 days, it is very less visible. Okay, so that is the surgical procedure. This particular surgery can be done under a local anesthesia in a daycare procedure. At the same time, it is one of the very commonest cosmetic surgery. By and large, it is permanent. You do not get it again once you remove it. By and large, it is permanent removal. The cost is highly variable depending upon the which treatment modality you choose for. Suppose if you just going for some peeling, then it will cost you barely few thousand rupees. Okay. If you go for the radio frequency ablation or CO2 carbon dioxide laser ablation, then it will go to few thousand. Okay. And if at all you go for the proper surgical removal, in which there is no possibility of the PIH or anything, then the cost goes to somewhere around 30-35,000 Indian rupees. Okay. The results are much more assured. So this is all about the xanthelasma. In this particular video, there is a before after of the lady. Generally it is more common in the lady. So she was much more worried that probably she got a vitiligo, but there was no vitiligo, it was a xanthelasma. We have done the surgery, so you have the before pictures, you have the after pictures, you can appreciate. Okay, we have shown pictures in both the open eyes, closed eye, so you can appreciate it well. And myself is Dr. Drvaibhavshah. My practice is in Mumbai, India. I only operate the face. I'm basically the face surgeon. So if you have any concerns regarding your upper eyelid or xanthelasma or any white patch, please feel free to contact me. My contact details, everything is given along with the link in a video. Okay. Thank you so much. That was all about the xanthelasma.